Imo State Governor Senator Hope Uzodimma said his administration is committed to reducing maternal and child mortality linked to inadequate facilities and healthcare access. Senator Uzodimma stated this at the inauguration of the 100-bed Senator Oloremi Tinubu Mother and Child Center in Awo Omama, Imo State on Tuesday. Uzodimma, who expressed gratitude to the office of SDGs for coordinating and bringing the project to fruition, noted that the center would further expand the medical outreach in the state. The governor said his administration had introduced mobile rural clinics, built 3 new general hospitals, and a specialist hospital in Umuguma. He announced that his administration had revived the Imo State University Teaching Hospital at Olo, as well as restored the accreditation of its medical school. This issue of child mortality and maternal and child mortality has actually been on a high rate in the country. This decision by Hope Uzodimma to working towards reducing it. So what's your thoughts on this, please?
I think Uzodimma, I wouldn't want to say that it's for him to reduce it, but I also have to recommend the wife of the president first, and I think for the 100 beds maternity healthcare, whatever I had. But then Uzodimma, is he, do I say if he's doing well or not? My stand and ground here is that it is a welcome thing, more especially that of our Mama area. I've been to that area and I know how they are suffering. People die, see mother and child die almost every time, because the quality of the healthcare materials they have and facility they have there, it's very, very low. And do I say that it does not get to almost everybody. Okay. It's a small place, and even the small place, do they even have staffs there? No, they don't. Medical accessories like the pills you cannot get. Now, I thank God for the wife of the president who, on her own infinite wisdom, decided to help improve the health sector in Imo State. And then with the support of the governor of the state, which is the governor Uzodimma, who on his own said that because he saw that one happening, he has to put in place other ones at Olo area. I think that he had to furnish another one at Olo. And I'm not saying that it should be only about now. You know, one thing is about them establishing this, and another thing is on them bringing people who are qualified to either keep it running and those who either take charge. You know, the wife of the vice president on her own, she said that they should take this thing as their own. They shouldn't see it like it's a governmental thing. Everybody should take responsibility in order to see how this thing is being run and give service to those in that state. Uzodimma shouldn't say because the president's wife has done or has brought this whole thing, and will say as usual, we have brought this thing to Imo State people and now back off. No, he should see this thing as a thing, as a facility that would help, including him and the people of Imo State, as to restore health again and for the safety of the unborn children that are coming up. I give it to the wife of the president for the steps so far.
Okay, you made mention about in as much as this is a welcome development, medical practitioners that will keep the place running. It's also necessary to have people like that. Because if we have to look back at the issue of brain drain in the country, do you think that this will hold? I actually wanted to find out something, but I thought I should just ask this firstly. What's the possibility, considering the parts of Imo State that this attention has been given? Do you think they will have that adequate personnel like you mentioned?
You know, we have this adequate personnel, like you said, everywhere. The thing is, I equally heard him say that he's going to, is it to accredit either a private or whatever. I know he made mention about getting professionals.
Yes.
I'll be initiating or bringing up something like either a school where medical professionals can be trained
Yes.
and be absorbed. Another thing is to say, like I said, it has always been like that. It has always been Nigerians want to initiate something, but after initiating, nobody is following up. And so I'm saying that we have professionals everywhere. We have them. It does not matter if they are coming from Ogun or Sun, wherever, but they should account for those who are actually real professionals, those who knows what they have gone out there to study. It shouldn't be people by Imam Mado, as I said. I mean, someone you know. I mean, my friend's brother or my wife's sister and all that. It should be people who are practically professionals in that field. I think I'm also pleading with the wife of the president, since she has brought this 100-bed hospital that he has given to the Imo State. She should also see how she can help the state in order to bring personnel who will run that place as a private personnel, but the place is being owned by government. And that's the only way I feel that place will be alive forever.
Okay, if you have to look at that part, the decision, the vow that's been taken by the Imo State Governor to reduce this maternal and child mortality, is there a possibility that the bringing in this hospital facility will reduce? Because it's one thing to say something, it's another thing to take a decision. It's also another thing to implement that decision that has been taken. Yes, this is a welcome development in Imo State. You know, like the part that has also actually gotten this benefits of this 100-bed facility that the Senator Oluremi has given to them. Although she has been making the health sector part one of her core responsibility to make sure. I think there was a time she actually visited Delta States, you know, distributing maternal kits. You know, there's just been this urge over mother-child mortality, you know, reducing it. One thing, like I stated, it's one thing to have the facility and another thing to implement a vow. Do you think this facility that has been provided will aid this reduction in mother and child mortality rates?
It will aid reduction because, you know, like I cited before, I told you that Imo State is a place I do visit often. If not for this, there are killing things that are still happening in that area. Imo State is a place I like going to relax. If not that this whole thing is happening, and I had to change to Bayelsa State. I think few weeks while I was in Bayelsa, I saw the same wife of the president doing the same whatever child and mother giveaway. I saw a program where she gave about 100 and something ambulance, and it's a mobile ambulance and other hospital kind of accessories just for the same mother and child. I'm saying that the menace that is happening in that Imo State shouldn't affect it. That's another thing. You know, although it's a place where I know that the attack has been taking place almost every week. So I pray that those hoodlums should not see it like something that is being done by the Federal Republic of Nigeria. You hear them always say things on the social media wanting to say that they want to be on their own, that they are no longer Nigerians, and you see the wife of the president wanting to develop the place and help them secure their children and their mother, for them not to either go down, you know, during childbirth and all that, birth and all that. But the mindset of human is different. The same way our faces are different, so is our thinking also different. So I don't know. I just pray that they should also understand that this thing that they brought is not just for the well-being of the entire people of the state. I think that's my take on that.